What if I told you there's a condition where your own body declares civil war on itself? Where your immune system, the elite force that's sworn to protect you, suddenly goes rogue and attacks your nervous system? Well, this isn't science fiction. It's a rare and frankly terrifying reality called Guillain-Barré syndrome.
It's a chilling question, isn't it? Because in Guillain-Barré syndrome, or GBS, this is exactly what happens. The immune system's powerful weapons are literally turned inward. It's a devastating friendly fire incident aimed squarely at the peripheral nervous system. That's the massive network of nerves connecting your brain to, well, everything else. It controls your ability to walk, to feel, even to breathe.
So, how does a betrayal like this even begin? The truly shocking part is that it doesn't start with some catastrophic event. Nope. It usually starts with something incredibly ordinary, like a stomach bug or a cold that you've already gotten over. And that's where the story takes this sharp, dramatic turn, from a simple illness to a full-blown neurological crisis.
Okay, so let's get the official definition on the table. GBS is an acute autoimmune disorder. Autoimmune literally means immune against yourself. Now, the target here isn't the brain or the spinal cord. That's the central nervous system. The attack is on the peripheral nervous system, all those other wires that connect your brain and spine to your muscles and organs.
Now, what's really fascinating here is the list of triggers. Look at this. The biggest slice of the pie, Campylobacter jejuni, that's a super common cause of food poisoning. It accounts for about a third of all cases. Other culprits include things like the flu virus, cytomegalovirus, and even the Zika virus. The main point here is the trigger isn't some rare exotic disease. It's often just a bug you fought off weeks ago.
So, why on earth does this happen? Well, the leading theory is something called molecular mimicry. Think of it like this. An invading bacteria or virus is basically wearing a disguise, a stolen uniform that looks almost identical to the uniform your own nerve cells wear. So, after the infection is cleared out, your immune system's special forces are still on high alert. They spot a piece of your own nerve, mistake it for an enemy survivor, and they sound the alarm to attack.
Once that attack begins, the progression is shockingly fast. This isn't a slow, degenerative disease. It's a neurological emergency that unfolds over just days or weeks. So, let's take a look at the timeline of this ascending weakness.
This timeline really maps out the whole journey. It all starts with that triggering infection, sometimes up to 6 weeks before any nerve symptoms show up. Then comes the acute phase, where the weakness spreads and gets worse really fast, usually hitting its peak within 4 weeks. After that, the disease hits a plateau, things stabilize, and then finally, the long, slow process of recovery begins, which can take months or sometimes even years.
For most people, the very first sign is a strange tingling, kind of like pins and needles, in their toes and fingers. But this isn't just a limb falling asleep. It's quickly followed by this deep weakness that's usually symmetric, so it affects both sides of your body equally. And it famously ascends, meaning it climbs from your legs upward, sometimes going all the way up to the muscles that control your breathing.
With symptoms moving that fast, you need a diagnosis like yesterday. But GBS can look like other conditions, so doctors have to become clinical detectives, piecing together all the clues to identify this invisible attacker. Let's dig into how they solve the mystery.
To build their case, clinicians often use a checklist called the Brighton criteria. So they're looking for that key symmetric weakness. A classic sign is when the reflexes are gone. When they tap your knee with that little hammer and you get absolutely no response. They also confirm that rapid timeline we talked about, and of course, they rule out anything else it could be, like botulism or a spinal cord injury.
And here it is. This is pretty much the smoking gun. A lumbar puncture or a spinal tap often reveals this very specific clue. It has this ridiculously long name, albuminocytologic dissociation. It's a mouthful, I know. But what it means is simple. The spinal fluid has a ton of protein, which is the debris from all the nerve damage, but a normal number of white blood cells. This tells doctors there's damage happening, but not from an active infection in the nervous system, which points right at GBS.
Okay, so the diagnosis is confirmed. The clock is officially ticking. The goal isn't to kill an invader, because there isn't one. The goal is to stop your own body's attack. Treatment is all about intervention and support, helping the body weather the storm that it created itself. So how do we fight back?
Well, there are two main battle plans, and get this, they're both equally effective. The first one, IVIG, is like sending in reinforcements. You flood the body with healthy antibodies from donors, and they basically distract and neutralize the rogue ones.
The second option, plasmapheresis, is more direct. It's like dialysis for your blood plasma, where a machine physically filters out all those harmful antibodies. If you start either one early enough, you can cut the length of the illness in half.
Now, this is so important to understand because it really highlights the severity here. While those treatments can stop the attack, they don't instantly fix the damage. As that weakness climbs up the body, it can paralyze the diaphragm and chest muscles. This is what makes GBS so dangerous. Somewhere between 20 and 30% of patients lose the ability to breathe on their own. They need life support from a ventilator, a machine that literally breathes for them.
Surviving that acute phase is the first huge victory, for sure. But what comes next? Recovery from GBS is often a long, really tough journey of rebuilding everything that was lost. Let's take a look at the long road home.
And here it is. This is probably the most important number in this entire explainer. Despite how terrifying this illness is, the prognosis is actually surprisingly hopeful. An incredible 80% of people will eventually get back the ability to walk on their own. Your body has this remarkable capacity to heal and regrow those damaged nerve linings. It's just a testament to its amazing resilience.
Of course, that journey isn't the same for everyone. Recovery can be influenced by a few different things. Being older, over 40, having a really rapid and severe start to the weakness, or having a type of GBS that directly damages the nerve fiber itself, all of those things can point to a longer and tougher recovery. And even for the people who make a fantastic recovery, GBS can leave its mark. You see, nerves heal very slowly, and a lot of survivors have to deal with persistent fatigue, numbness, or pain for months or even years. Getting back to normal takes immense patience and tons of grueling physical therapy. It really truly is a marathon, not a sprint.
So what's the big takeaway from all this? Guillain-Barré syndrome is just a stark reminder of the incredibly delicate balance inside all of us. It shows how our immune system, this system of absolutely breathtaking power, can be thrown completely off course by something as simple as a stomach bug, turning all that protective power against us. It reveals both our incredible resilience and our profound fragility, all at the same time.